Hello, this is Dr. Yolanda Cintron, and better known as Dr. Yoli. We are trying to educate our world about toxicity, how to be healthy, how to biohack our health. And I am delighted, and I just met you, but you were highly recommended by my colon therapist, Erin. She says she's very shy. And that you are not shy and you have a wealth of information of your lifetime, right?
Well, my lifetime, yeah.
So introduce yourself.
My name's Aqeel, and I'm a healing arts practitioner. And I've been through a few bridges. Two things. One, I was just sharing with the doctor that I have one offspring, and just shortly after my child was born, 8 of my teeth just fell out because I didn't have the calcium to support the embryo. Now, I do understand in England that they test your blood constantly to make sure your calcium levels are up. We didn't do that here. Of course, it was years ago when we weren't so kind, to certain people in those days. But that's okay. The one thing that I'm interested in is the root canal, because our typical dentists say to you, oh, you've got to have this done. During the time it was done, the most unfortunate thing was a beautiful lady, Dr. I won't call her name, but anyway, very diligent. In fact, that's all she does in her practice. And I thought, wow, why is that? All she does is root canals. And the fact that melaninated blood has longer roots, like the darker your skin, the more deeper your roots are. I didn't know that. So a 40-minute procedure turned into an hour and 40 minutes. It was the most frightening thing. And I'm still frightened about it, except in this country it's hard, unless you really know what you're doing, it's hard to access true information. So that, I would love for you to address that, the root canal, because that's
she just got a root canal, and she's speaking to Dr. Yoli. So God is just bringing us together for sharing of information. So I'm a biological dentist.
Okay.
So what is a biological dentist? A dentist that is more aware of the connection of the mouth, the teeth, with the rest of the body. So there is a connection because nothing is separate.
Of course.
But when people go to medical school here, somehow they become specialists of body parts. And I was never in agreement with that, because when we go to dental school, we are in medical school with the medical students. So we're doing anatomy with the same doctors and professors. We are doing gross anatomy. We're doing all the different materials. But on top of that, we're doing the specialty of head and neck, right?
And you know what's disheartening, doctor? Very seldom are you inclined to have nutrition in your curriculum. And how do we, that is our medicine, the food that we
the food is the medicine.
Yes.
Our parents knew it. Our grandparents knew it.
Yes.
Alternative medicine is really the only way to do it. They call alternative the real traditional healing arts, right? People, like I'm from Puerto Rico, if you had a tummy ache, they would go to the backyard, right? And they take some, leaves and whatever, and they make a tea. But going back to the root canals, okay? Because you just met me, and this is just
like what do you do once
providential,
you
right?
made that mistake? What happened?
Well, we are going to go to the back, and I'm going to show you somebody else's CT scan, and then you see what's going on. So I'm trying to find a meridian chart.
Are you here? Is it here?
There we go. Okay.
Ah.
So this is a meridian chart. So you can find it in our website, drcintron.com. This meridian chart has all the teeth and all the connections to organs. And then this is also muscles, bones, whatever. And you said you have a root canal on number 11. You pointed the eye tooth there.
I believe it's 11, yes.
But I'll mark it for you. So, but you have crowns, metal crowns with aluminum behind it.
Yes.
So do you think you have root canals on those two?
I have just one other from maybe 20 years ago.
And you know where it is?
No.
Okay. Because you told me about breast, no?
Yes.
Breast cancer?
Left breast.
Okay. So she was sharing about her history of stage 5 breast cancer.
Oh, and let me share one other thing with the
That's
audience.
That's the left
Yes, the left
breast
side.
right here.
Yes, left breast. Let me share
Yeah.
one other thing with the audience about having. Well, go ahead, because I lost my train.
No. You're gonna lose your train when I tell you. On the left side, I hope you don't have any root canals because that's where the breast meridian is.
The
for
what
breast.
meridian?
The breast meridian is
Oh.
tooth number 13,
Hmm.
14, 15, and those are the ones that I see that you have crowns on that side. So
yes.
possibly you have a root canal there.
Mm.
So that you have to remove.
Mm-hmm.
So after doing this for so many years, if we have 1,000 women with breast cancer, 998 women had root canals on the breast meridian.
I don't doubt that.
Only 2 did not have root canals, and they were 33 and 35-year-old women that were putting their phone on their bra.
Oh.
So when I saw their thermography, it looks like a monster was coming out of the breast. I said, oh, wow. First thing I said, have you ever had a root canal? They said, no. I said, do you put your phone in your bra? They both said yes.
Wow.
Different women. One was 33, one was 35.
Well, I was going to say one thing about the cancer. The one thing, and I was working at a wonderful place at the time, where we only had alkaline meals.
Fantastic.
Yes,
Yeah.
and so the story about cancer not being able to grow in an alkaline body, if you are stressed, I had extreme stress at the time. It overrode everything.
It does.
And
The
just
adrenals
caused
are
my little germs, my little my little cells to just get confused and suck in that cancer, and there was not much that could be done. I tried everything before I went conventional because I was totally anti-allopathic.
Yeah, but you're alive because you were on that alkaline environment, and you do colonics and other things.
My oncologist did say that the only reason I did make it where I was because of the previous lifestyle.
Exactly. Because we
So-
have young people here. We lost a 43-year-old with ductal carcinoma of the left breast. She had root canals, mercury, aluminum, gum disease, and I said, do you believe in God? And she said, no. I said, well, this is about the time that we have to seek God because we need a miracle, right? Stage 5 cancer.
Oh, yeah.
And
Been there, done that.
yeah, but she was not, she couldn't understand what was the link between the teeth and the breast. So they told her about me when she was like 39, and she was going to all different kinds of doctors. She kind of lost the adrenals were fire up. If your adrenals are plugged in, right, like a battery, producing adrenaline, your fight or flight, you cannot rest, you
No.
cannot heal.
No peace.
Yeah, when you sleep is when you heal. So she was awake. You can tell when somebody has cancer and they're scared
Yes.
because they're
It's
like
a scary thing.
like that.
Yeah, it's a very scary thing.
Yeah, she passed away.
Oh, sorry to hear that.
She passed away. Not that many passed away, but she came knowing about this information. She waited. And I had another lady. She knew about the root canals and the mercury 10 years prior. She had breast cancer. It came back 10 years after, but she waited 10 years to take action in removing the toxins of the mouth that were on the meridian of the breast.
Oh.
So he came back with a vengeance. So those are the 2 people, that we lost. But tell me how you got involved in colonics and all that. That's fun, huh?
Funny you should say you're from Puerto Rico because that's where I took my training at the Ann Wigmore Institute in Aguadilla, Puerto Rico. I love it. Yes.
Is she still there?
No. Well, the center is still there. Yes, of course. Yes, of course.
We should go there, Abby.
The most wonderful place to be.
In Aguadilla is Ann Wigmore. Yeah, in a way.
Yes. So that's how I got involved. I've always been interested. I'm a former social worker. Talk about stress. You do not have to go to another country to see poverty and hunger.
Exactly.
You can just go, around the corner here in the U.S. So growing up the way I did, I'm in my 7.5s now, 7+. So you were always taught America is the best place on the earth. Our health system is, and then when you really understand, when you really travel, that's when you learn what's really happening. Okay, our system really needs revamping because we can't continue to keep people ignorant. We have to. That's how you make the world better. When everybody has knowledge.
How are you gonna convince a man that loves to eat steak, right, and hamburgers,
well, we're not
and
even going to talk about,
right? Like,
yeah, but
how
that's
do
not
you
even,
change that mindset?
I think that's I don't even know if that's a real man. Think about it. For someone to be able to do that to another human being, I don't think there's much life in that person anymore. Excuse me for saying that. The soul, your soul allows you to respect humanity. And so sometimes you get people who aren't capable of doing that, so they've lost their. But anyway, back to the root canals. What do you do once you've unfortunately done that?
Well, the truth is dead.
Yes.
So there's a documentary. I don't know if you have watched. It's called Root Cause.
No, if I did, I wouldn't.
It is a documentary that was well done by an actual patient that is a movie producer. And he had an accident. They did a root canal on the front tooth, and his health started deteriorating as he got older. He got it in his teens. By the 20s, 30s, he was like traveling the world seeking for help, and nothing would help. You love that movie because it shows every modality of medicine. He went to different countries. He did everything that there is.
Yeah, I'm an innovator girl. I love a
so you'll see everything he's done, but
Aramaic.
then he was able to meet a doctor that measured his energy, and then found out that he had no energy in the meridian.
Oh, I strongly believe in that.
Yeah, so the battery, because the body is a battery.
Sure.
So if you go to the kitchen and shut down the electricity to the bedroom, when you go to the bedroom, you're not going to be able to turn the light on.
Right.
So when you have a root canal, that meridian is shut down. So the electricity and communication with the brain and the other organs is going to shut down. So he was able to meet professionals that help him just by removing. I'll write it up for you here.
Yeah.
Removing the tooth and regenerating that area. So you can find it at Tubi app, and it's called Root Cause, and it's a free app. And then you just watch the movie.
I love the name of it.
It's like an hour, and it's very educational.
Thank you.
Yeah. So pretty much we see patients that come from all over the world here
Oh, that's wonderful.
for that purpose. And I know the owner of Hippocrates, he sent people here. Last week we had somebody from Hippocrates, and he's very well aware and educated about the dangers of the root canals and the gum infections and the aluminum crowns that have, aluminum is connected to dementia. So, we're trying to educate people, and that's why we do the podcast, because we want to learn about what you do, and we want to talk about you.
Well, okay, so I'm a little bit excited right now because I am doing a class at a mental health arts center called Nine Muses.
Okay, where is that?
That's in Oakland Park, West, Fort Lauderdale.
Okay.
And I do a class called Body Awareness. And I talk about the simple things that maybe mommy and daddy were too busy to teach us when we were little. They're like, we do body tapping, we do laugh therapy, we do sound healing, we do the things that you can do at home, that you can learn about your body, how your body works, and you can do some of the things at home to work on yourself. Like there's a great one we do, a fascia facelift, which is things you can do yourself, So I'm really excited about that because my big thing is the healing comes from inside of your gut, you know, from your brain and your gut connecting. It doesn't come from the doctor. It doesn't come from the medicine. It comes from you deciding to open up and heal inside. So how do you understand that with our Western world? Okay, with everything, with the synthetic pills and everything else. Yeah. How do you get past that? So we do a lot of chi awareness, like teaching chi. How do you see how powerful you are just in your little body alone, you know? And things that will,
So you do Tai Chi?
we do something called Qi Kong, CHI, not QI.
Okay.
Because about 15 years ago, a group of healing arts practitioners and myself in Colorado, I was going through battling the cancer at the time.
Yeah.
We decided to take from Qigong, from Tai Chi, from yoga, from some of the massage modalities, and wrap it into a very simple process that people can be taught to do on themselves, on their partners, on their children, on their pets. And so that's still been going on.
We want to see a demo.
I would love to. Yeah, we could do something really cool.
That's so cool.
Yeah, that would be
So the person does it sitting down or standing up?
It depends. Sometimes we open the class with some kind of sort of, well, let me give you one example. If you just massage in the palm of your hand, just in the palm of your hand.
It could be left or right?
It could be left or right. I always start on the left because I'm an old colon therapist, so we start everything on the left.
Okay.
So you just massage in there. You are actually connecting.
Counterclockwise.
Well, you're going clockwise, and then you'll go counterclockwise.
Oh, it feels
But
good.
yes.
How do you do it?
You're connecting all of the meridians in your body right there in the palm of your hand. And then I have them just warm that area up. So just kind of warm, like palm to palm. Okay. Get a little energy going. And then kind of come away and see the force of the energy. Most people, the average person in America especially, doesn't even realize they have that force around them. So we just do a lot of body awareness, and it's fun because people go,
they're present.
Yeah, and we do reflexology. I do face reflexology, and there's a point right above your third eye that's soothing. It's very soothing. So say someone just ran the stoplight and you got to look like you didn't get in an accident, but you had one of those, okay, so you pull over and you just kind of circle right above the third eye, right above where your eyebrows go together. There's a little point there. It's considered an anti-anxiety point. And if you do it for 3 seconds, by the time you count to 3 and you do it, it actually gives you like a calming effect over your nerves.
Good.
Yeah, because it allows your vagus nerve to say, oh, okay, everything's fine. We do breath work, you know, some of the breathing. If you breathe a certain way, especially if you exhale longer than you inhale, then your body thinks, oh, everything's fine. But if you're breathing, you know, your body's like, oh, things aren't fine, you know. So you can control your emotions by your breath. And so we just talk about different holistic modalities.
That's wonderful.
Yeah. It would be great to have you come and do something, talk about dentistry. Yeah,
we'd love to.
It would be great.
Yeah, we're into anything that can help our patients because there's so much information out there, and then the patients come and they have 20 doctors, but we don't see any improvement. We don't see any improvement emotionally, spiritually, mentally. You know, it's all like you have to slow down. You know, what's upsetting you.
Yes.
You know, and then writing, I ask my patients to journal.
Oh, wonderful. That's great. I love the artist way.
Yeah. Journaling.
I asked my endocrinologist, last May I had, and I think part of it is when I had the battle with the cancer, there was radiation introduced, and so it's so close here. So my parathyroid glands were acting up, not regulating my calcium, and so I like to look deep into things. So I said, wow, whoever made us, they put 4 parathyroid glands on that thyroid, so that must be very important, okay? And sure enough, the only process, like your liver has 78 different functions, the parathyroid gland has one, those 4 glands have one function, and that's to regulate the calcium in your body. And so I'm first, it takes me forever to see the endocrinologist. 6 months, I'm serious, I waited 6 months. You could die in 6 months. So anyway, I say to him after a year.
You have to become your own doctor.
Yes, you do. You really do. So I say to him after a year of taking this, whatever the medicine is that would regulate my calcium, how long am I gonna, how long does, when is this gonna, when do I not have to take this anymore? You'll be taking this for the rest of your life. That doesn't work well with me. That doesn't work well with me at all. And so finding different ways to, I got into a little trouble when I was dealing with the cancer and attempting to use natural practices, okay? They weren't that effective for me. Some people, they were very effective with. I mean, imagine I'm doing colon therapy on people who come in with the diagnoses for cancer. They're getting ready to go to pre-op, and by the time we finish with them, which was sometimes I think a minimum of 3 weeks at this place that I work, holistic place, they couldn't find anything when they went to do the surgery. They couldn't find, so a lot of times it's toxins that are sitting there.
Most of the time.
Most of the time?
Most of the time.
Yeah.
I had a patient that she came here, and they diagnosed her with tongue cancer. So when I met her, we do a CT scan. The CT scan is scary because they cut her tongue, and then now she has staples all along her neck. And I'm thinking, why? They radiate her. When you have tongue cancer, radiation doesn't do anything, so why did they even radiate her? So then they did a PET scan, and she had an 18 millimeter tumor in her lung, attached to the part of the vertebra that's inoperable. So she went to Hippocrates, and she went for a month. Then she did a PET scan. They found nothing. So you know that
sometimes it's
something
really
works, right? The colonics, the vitamin C, the hyperbaric, the diet, doing everything alkaline.
The mindset.
Yeah, and she is on a quest now to educate. She has schools
That's
in
wonderful.
different
That's
counties,
great.
and she's on a quest to educate people. That's really important. What you do, what you think, what you feel.
Not to sound like a broken record, the dentistry, the price of everything is
the best dentist is no dentist.
The best dentist is no dentist.
So we spend a lot of time educating people how to clean their teeth, how to floss their teeth, how to clean their tongue, how to brush, floss, and do all this process every time they eat.
Yes, after each. That's what I learned, that the film, it's not so much the
it's the acidity.
Yeah,
it's
the film starts to cling to your teeth.
It gets stuck.
Yeah.
The bacteria start eating the tissues. But
what's your take on the chew stick? Because in Africa, they chew on a stick.
Yeah. I actually worked in Nigeria.
Oh.
So I treated patients that were using the stick.
Wonderful.
And then what I saw was very interesting. So patients that were in their 50s or over, 50, 60, 70, 80, 90, 100, they had no cavities. But they had, the wear out of the teeth, and also they have gum disease. But the young people with the new diets and in the introduction of the American diet, right? Soft drinks, sugar, they're packed with calories. So diet, the sugars are corroding, sugar.
That's terrible. I was a social worker years ago, and I was in a program where we were really trying to help these like socio-economically deprived communities, and that's when some brilliant person in our group decided to look into what is in the baby food. Do you know that there was sugar in the baby food?
My daughter never had baby food. We bought root vegetables.
Yes.
We steamed them.
Yes.
We put it on there, and she loved it.
Yes. Yes.
She loved the food. She could smell it. Obviously, we put lots of garlics and onions and things that were delicious. And
that sounds great.
Yeah.
Yeah.
So anything
Well, some
that
kids
is in
don't
a
even
bottle.
know where food comes from.
Yeah, anything in a bottle, a box,
Any packaged.
and a can, no good.
Absolutely.
Because if you buy a banana, how long is the banana gonna be fresh?
Mm-hmm.
A few days. If you buy a banana in a can and it lasts 2 years, how
Something's wrong with that
a
banana.
preservative,
To eat it.
right? A preservative is a chemical that is going to maintain the integrity, but your body cannot digest. Your body was not made to be able to process preservatives. So what's going to happen?
Yeah.
Your body's going to start malfunctioning
Mm-hmm.
with all those preservatives.
Mm-hmm.
And then once you start getting used to simple foods, right? The fruit, the soup, then you cannot go back to
Yes.
that process.
I'm 80% plant-based.
Mm-hmm.
Every now and then I'll get to a point where,
You need protein.
what's happening? I'm gonna
Yeah.
get some animal. However, my A1C, and I know it's the fruit. I know it is.
The A1C is what
It's
number?
high. I can't remember now because I get.
So 5.2 is good.
No, this was red, so it
Okay.
wasn't good.
So maybe it's a 6.
Something, but anyway, I know that I don't eat. I know that my diet is fresh foods.
Mhm.
Fresh foods. I don't eat. I don't go to a fast food thing. I don't
Yeah.
do any of that.
So it could be lack of
And I
exercise.
don't eat flesh. Well, I'm pretty good about that.
Yeah?
Yeah.
You
I mean,
think-
well,
how
here
much do
lately
you do?
too. Well, like for instance, this morning, probably because I was excited to come to you. But
You
this
walk?
morning I woke up.
Uh-huh.
I like to walk as soon as I wake up.
Yes.
Okay.
That's excellent.
Even if I've had a bad night's sleep, I like
Yeah.
to wake up. So I woke up and I did my walk. I had a meeting at 9, and I went to the pool afterwards. We have a little group that we do
That's
water
wonderful.
aerobics.
That's wonderful.
And then just before coming, like an hour before coming here, I took a little half-hour walk.
That's
So I
wonderful.
try my best to.
So you're doing good.
Well, my closest relatives are so far away. I
Mhm.
try not to get sick for, I mean, who's gonna help me? They're 2,000 miles away.
Right.
So I try to do things that I know are for
Longevity.
prevention.
Yeah, longevity.
Yeah.
That's wonderful. So yeah, the A1C is an indicator of diabetes, right, or longevity.
Yeah,
So-
but I think
So
it's.
if you're exercising and you're exercising, also what level of exercise?
Yes.
So there's different levels, different zones of heart rate.
Yeah.
So you want to have, the heart rate go into different numbers,
I like Christine Northrup, Dr.
Yeah.
Northrup. She
Mhm.
talks about that, like
Yeah.
just making yourself just for like 6 seconds,
Yeah,
just walking slowly and then vigorously go
Right.
after it. I like that because it does do that. What's it called? Where your heart rate is not level; it's up
Yeah.
and down. I think that's
yeah, when
important.
there's different levels, like 60,
I forget what it's called.
80 to 90, 101 to 129, 129 to 140.
Mm.
So there's different levels. So that is going to, be good for your cardiovascular,
Mm.
So there's a lot, there's so much information
There's so
out
much.
there.
Yes.
Lifting weights also, because
Weight bearing.
yeah,
Very
weight-
important
weight
after
bearing, so
40.
you can,
Yeah.
so nobody has to pick you up after a certain
Oh,
age.
please, yeah.
Yeah,
Who
forcing
wants that?
yourself, yeah. It's
Yeah, I was
wonderful.
laughing the other day. I wasn't laughing. I was laughing in a sad way.
Yeah.
I went into a drugstore and there was an aisle, an entire aisle of those pee pads, you know, that for incontinence.
Oh, okay, got it. Mm-hmm.
Yeah, and I thought, now they spend all that money on that. How do you prevent this?
Exactly.
What can we do to prevent it?
Exactly.
And I
The
know that there are things we
exercises.
can do to.
Absolutely, yeah.
Yeah.
There's a lot of exercises to make your insides, you know.
Yeah. It's unfortunate
muscular.
our what is it called? Medical complex, our pharmaceutical, you know, it's driven on how much money you make, and how much money you make is how many pills you can push on someone. And
Yeah.
that's pretty sad.
Well, what's sad is that, you know, people have choices, and then people have to get educated.
Well,
Because
the
the
education
information
is
is
the whole
out
thing.
there, you know.
Yeah, now
But it's
there's no
difficult
reason,
changing,
right? There's no
changing
reason.
habits.
Yeah.
People associate eating certain foods with family and love
Oh,
and being
sure.
loved, you know.
Yeah.
And then they feeling connected, you know. So, you know, it's certainly, I'm sure that when people are having a barbecue, they're not inviting me over. They're like, she's gonna ruin it for us.
Oh no! You know, the most exciting thing is the carrot hot dog. If you grill a carrot,
Okay,
you cannot tell the difference.
get out.
And you make it like, you know, put all the crap on it that you do
Yeah,
with
yeah,
the hot
yeah.
dog. You cannot tell the
Oh
difference.
my God,
It's even the
imagine.
color goes. So the kids, you know, they go, "Oh, Mom, this hot dog is so good," and it's a carrot.
That is so
Yeah, I
cute.
think that's beautiful.
That is so cute. That's wonderful.
Yeah.
So, you know, you have a lot of life experience. So what would you share with our audience about 3 things that you would recommend that you have learned in your lifetime that are important?
I know that the number one most important thing is your self-talk.
Mm-hmm.
Like, you can smile, oh, she's so friendly, oh, look at her, she's
Mhm,
smiling,
mhm.
but how do you really feel inside, and what are you telling yourself inside?
Mm-hmm.
Oh my goodness, am I being authentic, or,
Mm-hmm.
you know, what is going on? So I think self-talk, like, how do you really feel? Because your body, I believe that the universe answers what you are thinking and feeling,
Mm-hmm.
not what you say.
Exactly.
Yeah, I'm having a great, how are you today? Oh, I feel fine.
Mm-hmm.
But do you really?
Yeah.
So I think self-talk is number one, and I think to get to self-talk, it's really important to understand your self-talk. Understand that when you say, oh, God, she's much prettier than me. What are you saying? What are you saying to yourself, you know? And when you think of yourself in a way that's adoring, that's loving, and I know that sounds like a cliche, like love yourself, but it's so important. If you don't really find a way to appreciate yourself, it's very difficult to, I think that's why part of the world is so unkind, because you're really, if you love yourself, it's really hard to be cruel to another human being. So I think self-talk is number one. Practice every day. I find, no matter if today I do the wonderful things, my steps, I made my 5,000 steps or whatever, tomorrow it starts again. So there's no, like lapse time. So I believe that it's important to understand that the body appreciates consistency and doing it, like sort of getting a good night's sleep and learning about, I'm going crazy right now. I've got about 30 books in my house on feng shui in a small place, because I'm in a small place now. And so learning how to put things in a way that the energy is not interrupted. And I think that's
I'll
important.
invite her over, Ali. The feng shui of my condo.
So I think that's important. And like this, the third one would have to be, for me, the third one would have to be my nutrition. What am I eating on a daily basis? You know? So those are the 3 that I think are very important.
Yeah, that's the Bible says that our body is the temple of the Holy Spirit of God. So if
That's powerful language.
if our body holds the Spirit of God, which is holy, and we want to take care of our temple, which is the Spirit of God, then, you know, He is the source, He is the wisdom, you know, asking Him to tap into His knowledge, you know, and if He's love, then we have to love others as we love ourselves, as the second commandment, but that's implying that you're loving yourself.
That's implying. That's
Right.
an implication.
So, you know, love God first. To me, it means me seeking God. I love her, I'm seeking her. So we seek those things that we love, you know. So if that's the first commandment, the second commandment is to love yourself as, you know, love the neighbor as you would love yourself. Is implying 100% that you love yourself, because you cannot give what you don't have.
No.
Yeah.
And we
So-
do it all the time. People.
So yeah,
Yeah.
we live in a society that is so externally driven that, you know,
And it's not
you have
authentic.
to start with you.
Yeah, it's
Mhm.
not authentic. You can get praise for lying. You know, you can
Right.
get points for lying. I think that's
Yeah.
my brother and I were talking the other day, and he was saying, you know, the kids don't. Oh my goodness, the kids don't have.
That's a good one.
Sorry. Sorry.
That's okay.
And it's my daughter who really calls me this time.
That's okay.
The children today, in communities that aren't
Mhm.
financially astute,
Mhm.
they don't even have a concept of what's right or wrong
Mhm.
because they come away from the churches. You know, and
Mhm.
when I grew up, the churches were like that was your paramount. That was your
Mhm.
school after school.
Mhm.
Yeah. So you
Your
were
family.
taught.
Yeah.
You were taught how
Connection,
to be a human being. You know.
Mhm.
And I think that's important, is to learn how to treat each other, how to
Yeah.
treat yourself,
Yeah.
you know. So
Well, thank you so much. I know that you have a phone call, but thank you so much for joining us.
Thank you
We
for having
really
me. This was
appreciate you.
impromptu. I had no
Yeah.
idea we were gonna do it. It was
That's
great.
okay. That's okay. God opened up the space and the time,
Yeah.
which is, you know, perfect. God's timing is perfect. Thank you so much. I hope that we hear from you again.
Yeah,
And
absolutely.
then, yeah, definitely the root canal tooth.
I will definitely.
Yeah, you can definitely, you know, we'll do a courtesy CT scan for you.
Oh,
When you
thank
come
you.
back,
I'll take
so-
it. I'll take you up on that.
Yeah.